missing out. Y'all missing all this great conversation we got going on here.
Okay.
Yeah.
Yeah, there's no way to film them all with one. I think the two small cameras are catching YouTube.
Okay.
The pink one is Facebook and Instagram. The black one is TikTok.
Okay.
Am I good spot?
You're live.
And we're live.
Are we live? Are we live? Oh, wow. Woo, Lord, finally. I know we usually try to come on at 12 noon, but today is a special day. Kind of threw us a little behind our schedule, but today we actually have some guests. I mean, this is like, I'm so excited, man, because I never had guests on this. You know, I want to say guest on my show, right? You know, like I got a show. But what it really comes down to is that, you know, this is just our live. And, you know, our conversations are real. You know, we have real conversations. You know, I know you guys already know who I am. I'm Dr. Melvin Fussell. I'm a board certified urologist for over 20 years. So I've been taking kidneys out, bladders out, prostate cancer, all this, you know, all this cancer surgery, managing patients in ICU. But now all I do is male enhancement and erectile dysfunction. So the thing is that, you know, I'm focusing on what guys are really asking for, you know, what really affects them, you know. So the thing is, this thing is kind of blossomed where we're starting to have these conversations about different subjects. So today, I have a treat for you. You know, all the way from South Kakalaki,
North Kakalaki.
North Kakalaki, Fayetteville.
Yeah.
Fayetteville. I have Carl and Yolanda here that are visiting. Actually, today, Carl had our procedure. He actually had it done. Man, I can tell you, you know, you and I was talking, you know, you saw me on social media and all this other kind of stuff. And I was like, you know, it takes a lot to see a guy on social media. Then you got to trust him enough that he's going to do what he says he's going to do. Going to drive down several hours to come.
6 to be exact.
6 hours to come and see me after seeing me on social media. And then you got to trust me to work on your junk. I mean, you know, the thing is that, you know, and I told you, I said, you know, most guys actually will take a nap or whatever. Man, Carl, you took a nap. You actually started singing. You said you didn't remember singing during the procedure. Dude, you're so relaxed. I take that as a compliment. Thank you. And I praise the Lord that, hey, you could come this far and we can get you this comfortable, that we can make a difference like that to the point where you can actually fall asleep and be relaxed on the table. Yeah. That I consider a blessing.
Me too. Me too.
Yeah, man. So before we jump into this conversation, so today, what we're going to be talking about is something most men think about but rarely admit to. Why size affects confidence so much. So Carl and Yolanda are going to be kind of jumping in on this conversation. You know, so you can hear from a female's point of view. You can also hear from Carl's standpoint, knowing also that Carl just had the procedure done. But before we jump into all of that, let's just talk about today, Carl. Tell me what you think about what you went through.
Well, right now, I feel pretty good. Beforehand, the numbing, little scary, but it wasn't as bad as I thought it would have been, you know. So, but the results that I got today, I'm pretty happy with. You know, we'll see before the 90 days to see whether or not a second procedure is necessary. But right now, I feel great about it.
So you just got off the table within the last 30 minutes.
Yes.
You know, and here you are doing an interview within 30 minutes of having the procedure.
Mm-hmm.
No pain. That's why I said no surgery, no cutting. It's painless. Go home same day, back at work the next day, and it's permanent for life. Now, I always tell guys, they say, well, how is it that it's permanent for life? because our filler is a biostimulant. It's going to cause your body to make its own natural collagen. So what happens is that the filler dissipates over time, but you develop all this new collagen matrix. That's your tissue. So within a couple of years, filler's gone. All you got left is your tissue. That's your tissue. Scratch it, cut it, it bleeds. If you lose weight, gain weight, it doesn't matter. That's your size for the rest of your life. You know, I've had this procedure done twice. So the thing is that your size is not going to be fluctuating. It's not like some of these other things that are not permanent or fat transfer and all this other kind of stuff. This is your normal tissue for the rest of your life. Big boys for life. Changing the
Y'all
game.
making me scared.
Don't be scared. But you know, the thing is you were telling me earlier, you guys have been married for 34 years.
34 years. Yep, 34 years.
Can we get some claps in the chat on that? 34 years. That's a beautiful thing. I can tell you that my wife and I have been married for 35 as of December. You guys are 34
In September.
in September.
Yes.
Yes, that's awesome. 34 years. It ain't easy making it to 34 years.
Not easy. It's doable though.
It is definitely doable, you know, but you hit a stride and you realize that this is us for life, you know, and that's a good feeling. You know, I can tell you, I am thoroughly enjoying being married. I mean, you know, there's some times, man, she come,
That's what we're supposed to do.
I'm just like, oh, I know right now she'd be having much to say. But the thing is that, to find your God-given mate, you know, is a beautiful thing. And then the thing is that as the years go on, you become so comfortable with one another and comfortable with each other's bodies and all this other kind of stuff. And then all of a sudden, Carl does this thing. He goes and get a BDL. He becomes part of the big D league. So what was comfortable before changes. Yolanda, you ready?
We gonna see. I think I can handle it. I'm a big girl. We'll see though.
Yeah, so the thing is, that's the beautiful thing about, you know, this whole thing with male enhancement, especially with our married couples and things of that sort, where, you know, they get a chance to, you know, enhance. I think that once you are married, the worst thing you can do is become complacent.
Right. Right.
You know, and you start taking the relationship for granted.
Mm-hmm.
You know, you just think, oh, we good. We've been married for 20 years.
Right.
It is what it is.
Right.
No, that's the worst thing. You got to always keep it spicy. Don't you agree? Yes.
Yeah. So let me say this really quick about the 20 years, 30 years, 50 years, whatever it is. I think it's important that you enhance it, spice it up, like you said. And so I can remember when Carl and I had got into a rut where, okay, we're gonna have sex, and then what's next? You know, I enjoy it, he enjoyed it, but to the foreplay part, you know, all of that stuff, it's important. Like you were saying earlier, I'm gonna go ahead and say it so I won't forget. I always thought that for a woman, we had to relax, the atmosphere had to be right, we had to be mentally in that zone. But for you to tell me that a man has to be in that zone as well, I didn't know it, for them to be having an erection and for them not to come so fast.
Right.
I didn't know. I'm just like, what you doing, dude?
I can tell you, you know, we get a chance to kind of discuss this kind of stuff because there's a lot that happens as far as, you know, the autonomic nervous system or the central nervous system. You know, we're going to touch on that later on in this conversation. But since you brought it up, you know, I have guys that, you know, when they say I have erectile dysfunction, erectile dysfunction can be very broad. That means that I can't get erections at all. Or it means I get erections, but it's not as hard as it used to be. Or it could be I get erections, but I come too fast.
And that's still ED.
All this is part of ED. So when we talk about erectile dysfunction, it's actually very broad. You know, so I have to figure out what's really going on with the guy. then I got to break it down. Is this a blood flow issue? Is it a nerve issue? If it's a desire issue, all those things fall in there. And then there's a fourth component, a psychological issue. And that's part of what we're talking about today. It's a psychological factor of what happens that affects guys. And because of their size and because of their erections, it's a psychological factor. If I got guys out there who actually have talked to us in our office and they haven't had sex in over 10 years. I mean, you know, I'm like, why? What's going on? And part of it is they are so concerned about their size, you know, their confidence is so low that they avoid intimacy. And a year passes, 2 years pass, and now you kind of falling into a rut where, you know, I'm really worried, you know, that I might get my feelings hurt because of my size.
That's what I was going to say. I have a girlfriend, no names mentioned. She says that she is not able to, what's the word I'm trying to use? I want to use the proper word. What's the word?
Just say it. Just say it. I'll help you out.
She can't
Lubricate.
She can't come with a man inserted in her. She can only come with she can't come with penetration, but she can only come with oral sex. And I believe it's what you said, you know, that whoever those individual men are, if the woman makes them feel like, oh, you haven't done anything, and I haven't enjoyed myself, then that makes them have that complex too. I don't want to have sex anymore because I don't want my feelings hurt.
Wow. That can get very deep. And the thing about it is that this whole thing gets into a mental health issue.
Yeah.
You know, what we talk about. So let's talk about the psychology of size, because this is kind of a segue to go into this. Why men care so much. All right. So today, if you're just joining us, you know, we're here with Carl and Yolanda, and they're from North Kakalaki. Fayetteville. Yeah, actually, Carl drove down and he just had our procedure done today. You know, he's over there chilled out. He said, hey, no pain, everything was fine. You know, he's happy he had it done. Talking about a second round, we'll see what happens. You know, but what we're talking about is something most men think about but rarely admit. Why size affects confidence so much? Is it biology? Is it culture? Or something society taught us?
Well, I don't think it's either with me. It's one of them, but it was just a confidence thing for me, you know, wanting to look a certain way. I mean, it's just like a person working out. If you work out, you know, you want your body to look a certain way. You know, so you be confident and say, okay, I'm going to the beach and I'm gonna take my shirt off, you know. And, you know, if you end up at a nude beach, I want to be able to walk on the nude beach and be confident, like, oh, I can take it off, you know.
Well, here's the deal. And you and I talked about this a little bit earlier, is that I'm a urologist for over 20 years.
Mm-hmm.
I do prostate exams, you know, testicle exam, penis exams. So I've seen thousands and thousands and thousands of guys, you know. I always joke with guys. I say, hey, if you shake his hand, it's his finger. I check thousands, you know. You sure you wouldn't shake my hand? But anyways, the thing is that you were already above normal size.
Okay. Like I said, I didn't know that.
Yeah.
And, you know, I mean, and then how would I know that?
Right. It's not like you whipping it out and say, dude, let me see what you got.
Right.
Let me see what you got.
Yeah,
you know, now guys are swinging, you know, like, you know, man, get away from me. You know, but the thing is, so the thing is that, you know, you were already above average size guy.
Mm-hmm.
You know, so, you know, after this procedure, dude. Yeah, for sure. Yeah.
Like I said, I had no idea of that, you know. Just like you said, I had nothing to compare it to. So, I mean, it was just something that I felt I needed for myself.
Yeah. So guys, y'all can throw out in our chat out there, have you ever worried about size at some point in your life? I mean, the thing is that because it affects your confidence.
Mhm.
Carl just said, I felt like it would be a confidence boost. He didn't even know that he was already above normal size, but the thing about it, it depends on you. This is not about being small. This is about wanting to be bigger. And this is about your confidence. So you don't have to think that, hey, I got to be small to actually decide to do something like this. It's about what makes you feel good. You only get to live once. And that's what this is about. So let's talk about where the pressure starts. Those psychological influences. All right. Some of the talking points we're going to touch on here is what locker room comparisons. Being in the locker room and stuff like that. For guys that play sports, you see it all the time. The guy, he turns towards the locker, he whips his towel around quickly, he makes it tight because he don't want it to fall off, right? In front of everybody else, right? Because he don't want everybody to see his junk.
Mm-hmm.
You've seen that. You've seen that back in the day in locker rooms and stuff like that. It happens where, teenagers, we create insecurity amongst each other.
Right.
Little boys joking back and forth and all this other kind of stuff. And then the cultural jokes.
Mm.
Right.
Yeah.
Mm.
If you're a black guy, you got to be swinging.
Right.
I think personally, there's a lot of pressure on black men.
I don't know. I really don't.
I can tell you that, because culturally, the word is that black men are actually bigger, more endowed. Thank you. That's what I'm looking for. Yeah. So, have you heard that also?
I've heard that, but I don't know if it's necessarily true. I mean, the color of your skin shouldn't make you bigger. It's the color of your skin. Genes, and not necessarily.
That's the myth. It's the genes.
Okay.
It's in your genes.
Mm-hmm.
And I ain't talking about your blue genes. I'm talking about your genes, your DNA. It's supposed to, according
that
to
black guys have a genetic disposition to be bigger. Just like, black males have a tendency to be better in certain sports and all this other kind of stuff.
Right.
Just because they got a genetic predisposition.
Right.
One of the things that, if you're a black guy, that means that you're supposed to have a big penis.
Right.
Which is not always the case.
Right.
Yeah.
Yeah.
I can tell you, I know. And I realize that for black men, it's a lot of pressure.
Mm-hmm.
There's a lot of pressure out there. And, and then too, if you got somebody like, girl, he can't do nothing for me, but that don't be anything.
Right. Right.
Right. I've seen some guys come in with their heads completely jacked, confidence just flattened, because of comments like that.
It would be so nice if they would be able to come back and share a testimonial or even message a testimonial to you.
Well, that's what they supposed to do.
Yeah. I've had a couple of guys that, have come back and said some stuff. And we got some testimonials on our website. Go to our website, which is UroHard.com. That's UroHard.com. Or you can call our office at 478-225-9324. So now, if you're in on the chat, just put your opinion about that. Have you ever thought about, your size of maybe wanting to be bigger? Because now you can have it done safely. No surgery, no cutting. It's painless. Go home same day, back to work the next day, and it's permanent for life. Carl just had the procedure within the last 30 minutes to an hour.
Right.
Yeah. Feeling fine, right?
Feeling great.
Yeah.
Feeling great.
Yeah. So, hey, he's got a BDL down there now. So here's another thing that affects guys is this media and porn influence. What do y'all think about that?
Overrated, because him and I were talking a couple weeks ago, I think, and he was saying that a lot of times the guys that are in porn have gotten a procedure done, and the watchers, the viewers, don't even realize it. They just think this is their natural state,
Right.
not realizing that they've had some enhancements done to make them look like that. And then just use me and Carl. Let's say if I watch porn or we're watching porn, not that we do, but if we did, I can look at him and say, why are you not looking like that? Or why? I mean,
Right.
can we try this? But it's
Right.
because of TV and making making the viewers think that this is how it is, but not necessarily, because a woman's vagina is different sizes as well.
Exactly.
So,
and the thing about it is that the thought of what normal is now distorted.
Yeah.
Yes.
You know, because you're watching this porn, you think that you should have something down to your kneecap.
And you can't have.
Yeah. And the thing about it is that in most cases, women don't enjoy something down to the kneecap anyway. It becomes uncomfortable.
Right.
We had this whole discussion before about the female vaginal anatomy. Because when we start talking about the female vagina, the nerves are located in the walls. So it's not length, it's girth that matters. Now, as far as the nerves are within the first 1 to 2 inches of the vagina, the majority of the nerves. So now when you're hitting all the way to the back, you pass the enjoyment point. She could have enjoyed the first 1 to 2 inches. But no, you want to be 10 inches. You want to go to the back and cause discomfort.
Right.
You know, when she had enjoyment and within 1 to 2 inches. You know, that's because you don't understand the anatomy of the vagina. So that's the whole thing. You know, because size, when it comes to size, girth matters more than length. I'd rather be a 4-inch burrito than a 10-inch pencil.
Mm-hmm. Let me say this for women, because I remember when Carl brought it to me that he was interested in having a procedure done. My thought was, why? Because I'm enjoying what we're already doing. But because he said he wanted to do it for his confidence, then I was like, okay, no problem. So the girth, like you said, really does matter, because like you said earlier, he was not small, you know, but the girth makes a difference. And so I'm excited.
There you go.
I'm excited. I'm excited.
I told Carl, I said, hey man, I'm sure you've never had any complaints in your life.
No,
I mean, you
not for
know,
me.
so
Not for me.
I said, because you've never been a small guy. So the thing is that, you know, but just like your response was, how would I know?
Exactly.
How would I know? You know,
That's not like I said, I don't go around. I don't go around. You a doctor, you do this for a living.
right.
So you know. But I don't go around out and checking other people out. I just don't. It's other men. Put it that way. I don't go around checking other men out. So I would never know that above average, you know, was my. But I just, like I said, I wanted the procedure done because just to give me more confidence.
There you go.
Just to give me more confidence. That's it.
I can tell you that, you know, when I first saw this procedure, because I've done other types of procedures for male enhancement, like I've done the fat transfer, I've done the implants and all this other kind of stuff. This is the first procedure that I saw where I said, hey, I want that for myself.
Wow.
So the thing is that I went to my wife and I told her, I said, hey, I want to have this procedure done. She was like, why? You know, we've been married, you know, over 30 plus years. Why do you think you need to have it done? I was like, well, at the initial thing, it was like, you know, if I'm going to tell other guys to do my procedure, it means a lot if I've had it done myself.
Right.
You see what I'm saying? You know, now it's like, am I just shooting smoke, or do I really believe in what I'm doing?
Right.
So the thing is that she didn't even argue that point. She was like, sure, go ahead on and have a procedure. But then the thing is that once you have this procedure done, you know, and you heal up,
It's addictive.
He said it's
you can actually come back and say, I want to be a little bit bigger than that.
What?
It's addictive.
It's like tattoos, huh?
Yes.
yeah.
It's like, yeah, it's addictive, you know, because, you know, so I came back a second time and I was like, I want to go back a second time. She was like, oh, hell no. Why you want to have it done a second time? And I was like, well, first time I did it for them.
Mm-hmm.
Second time I'm doing it for me. This is about my confidence. I'd already done her liposuction because at the time I was doing liposuction.
I wish you were still doing it.
I get asked that all the time. Can you do my lipo?
Word.
Yeah. So the thing is that, you know, she couldn't argue that because I was like, I didn't question when you wanted to have your liposuction done. That was something you did for your body, your confidence. It's something I'm doing for my body, my confidence. Just like Carl, it's for my body, it's my confidence. And you understood that.
Right.
I mean, most good wives would,
Right.
you know.
Right.
So it's like, hey, you're doing it for your body, your confidence. And I can tell you that confidence spills over into the bedroom. I can tell you because I'm excited for you guys. It completely changed our bedroom.
Wow.
Yeah, it's
nice.
It's on another level.
Very
So the thing is that this
and I'm about to retire in June. So
yeah, so
yes.
My bedroom.
Not very
the confidence factor. So I can tell you the core psychological point is about confidence.
Mhm.
You know, now confidence affects performance. Do we agree with that?
Yes.
Without a doubt. Now we talked about this thing about anxiety because you kind of mentioned earlier about relaxing, because anxiety can cause erectile dysfunction. I mean, most people don't realize that. Yeah. You know, and when we talked about this whole thing about erectile dysfunction, I would say it could be I can't get erection at all, or I get erections but they're not as hard as they used to be, or I get erection but I come too fast. All that falls in this umbrella of erectile dysfunction. So when I'm talking to a guy, I'm trying to figure out what form of erectile dysfunction is he saying that he's having, you know, because I got to figure that out. Now, the thing is, it takes three things to get a good erection. You got to have good blood flow, good nerves, and desire. That's a testosterone factor. You know, we've had conversations about blood flow. Blood flow can be affected by diabetes and hypertension. Nerves can be affected by surgery. You know, like if you had your prostate removed, or colorectal surgery, or something like that. Desire is your testosterone factor. All right, is your desire, your testosterone hormone where it should be. But there's a fourth factor out there, and that's the psychological factor. All right, the psychology of it all. So the thing is that because we kind of touch on this whole psychological thing, is that from a psychological standpoint, if a man is there and psychologically he sees his wife or significant other, and you know he's like, wow, she's really looking good today. You know, he's turned on, and you know that goes through the central nervous system. And, you know, they're nice and relaxed, got a glass of wine, or they chilled out at home. You know, now the autonomic nervous system is kicked in, and there's a parasympathetic side, and there's a sympathetic side. The parasympathetic side is nice and relaxed. That's a glass of wine, lights down low. The sympathetic side, somebody pulls a gun in your face, says, give me all your money. You know, that's the sympathetic side. Your heart starts to race, whatever. Those are extremes, all right? So now erections happen during a parasympathetic state, when he's nice and relaxed, all right? Ejaculation happens during the sympathetic state when he gets too excited. Same nervous system, all right? But they also control erections and ejaculation. So a guy tells me, he said, hey, doc, I come too fast. So he's in there and he got erection. He's nice and relaxed. And he's getting into it, right? He's enjoying himself. She's enjoying him. And it's just the first minute and boom, that pendulum swung across and he became too excited. And the sympathetic side of the autonomic nervous system took over and he came too fast. You know,
she's disappointed.
She's disappointed. He's disappointed.
Right.
If he's disappointed, what does that do to his anxiety level? It goes up.
Yeah.
All right. That keeps him in a sympathetic state. She turns around and she's upset, like, dang, he did it again. What does that do to his anxiety level?
Well, I'm an honest person. You talked about truth.
Okay.
And if I'm overly excited, I let it be known. I am overly excited. And
so I need to not expect nothing.
Yeah.
Don't expect no long.
I let it be known.
Either.
And normally it's because we're very busy. And sometimes time passes by. So when I'm overexcited, I'm like, oh, like you said, when that sensory hit, I'm overexcited. I already know.
Yeah.
You know, it's don't get me wrong, I want to please you,
Mm-hmm.
but
Mm-hmm.
I'm just trying to get this out.
And you know the thing about it is that that's a man that understands his body. You already realize that if I'm overly excited, I'm probably going to come very fast.
And we talk about it. He tells me, so I know not to expect what we got last week or what I got yesterday.
Right.
I know for a fact that he gonna go ahead and come real fast, but then later on that night,
After he's calmed down.
Yes.
Yeah. So the thing is that basically, you know, that's what I try to get guys to understand about their bodies and all this other kind of stuff is you got to understand how you're controlling this. So take, for instance, the guy who has premature ejaculation. He comes too fast. All right. So he's swinging over here to the sympathetic side of the autonomic nervous system. If he understood that, he'd be like, I got to calm down.
Mm-hmm.
You know, maybe I need to back off a little bit, you know, do some foreplay, do things that she enjoys, because penetration would be just too much for me. I know I would just pop off.
Right.
You know, so I got to back off and try to calm down. Or she might need to say, hey, calm down.
Yeah.
Yeah, I've actually had my wife say that, baby, you got to calm down, because I was just like, man, it's been a long time.
Right.
So anyways, you know, just calming down, because once you start understanding that. Now, what I have to do for guys who can't get their mind wrapped around it, I have to start them on an anti-anxiety medication.
That makes sense, though.
Yeah, it makes sense. Because I realize anti-anxiety medications will actually keep them from coming too fast.
Mm-hmm.
You know, so if I can keep them calm with the anti-anxiety medication, then the thing is now they get out of that rut, because you're like, I don't want to come, I came too fast, and I'm upset.
Right.
And then you get in there like, I don't want to come, I'm upset, I don't want to. So now you get into a loop. You're mad because you're coming too fast. You're coming too fast because you're mad.
Oh Lord,
You know, so now the thing about it is that every time, you know, we enter into sexual intercourse, you know, by the time I penetrate within the first couple of minutes, boom, I'm popping off. She's upset, you're upset, and you can't seem to break yourself out of it.
Right.
So the thing is that what we do with these anti-anxiety medications, if I can calm you down, if I can help you understand why this is happening, then you can get control with your mind where you don't need anti-anxiety medication anymore. Okay.
You know, I love this because you're giving knowledge.
Thank you.
That is so awesome. So awesome. And just to say, like you were talking about having intercourse for couples, it's important to communicate.
Yes.
Very important to communicate. But men, I'm gonna say it because I'm the only woman be here. Men have a difficult time communicating with their spouses, with their girlfriends about what they're feeling and what's really going on. And that leaves us in the dark, not really knowing that, you know, you need to calm down or whatever. You know, all we figure is we in the moment.
Yeah.
You know?
Yeah. And I'm gonna tell y'all, I appreciate this adult conversation that we're having here, because this is a very adult conversation. You know, we're all older. We're blessed to be older. We're all well kept, you know, because we've taken care of ourselves. Here we are. And, you know, we have been in marriage for over 30 years. So we're not out there trying to figure it out. No, we're into a group pattern at this point. And what we're trying to do is we're dropping these little knowledge bombs about what it's like, you know, after 30 years with a spouse. You know, what's it like to maintain confidence and things like that? It's okay to go ahead on and spice up your bedroom and things of that sort. Don't just be satisfied with the norm.
And no shame in men having to come and get an enhancement if they choose to.
Yeah.
This is, but some men are shamed.
Yes.
You know, there shouldn't be any shame.
And the beautiful thing is that you're so supportive. I got so many guys that come, they don't even want their wives to know that they're getting male enhancement. I'm like, how you gonna hide that?
Yeah, he told me that for him that he's gonna afford his wife for the 40 days.
Yeah.
Really?
I don't know how.
I don't know how they're gonna do it. I'm like,
Me either.
I can avoid it for 40 days.
I'm
You
a
know?
spontaneous person.
So I'm just like, use the truth like a weapon. Tell the truth. Just tell the truth.
That's right. That's
You
right.
know, so the thing is that if you get into this pattern of telling the truth, then your spouse always knows that, hey, he gonna tell the truth, even if it hurts your feelings. Did we talk about this?
Yeah.
Yeah.
Tell them how it's hurt people's feelings.
He's so brutally honest.
He and I are so much alike. You know, it's
Oh, my
something
word.
about that brutal honesty.
Then I have to be the one to kind of smooth it over. He didn't really mean it like that. See?
Just like I
You
said.
shouldn't have asked me.
Yeah, I mean it just like I said.
Yeah, I can tell you, man, I've got family members out there, who've gotten upset with me because they asked me questions and I was beautiful. I wasn't trying to be brutally honest. I just said, hey, this is going to be a problem for you. And if you don't make some changes,
That's right.
you're going to die early.
That's right. Wow. Yeah.
I mean, I don't know if I'm going to live longer than you. Only God knows that.
Right.
But when we look around, we know that, hey, if you keep doing what you're doing,
Right.
you will be gone. And based on the numbers, you got another 15, 20 years before you're dead.
Right. Right.
Maybe.
Yeah.
Yeah, maybe. If you don't make changes.
Right.
You got to make some changes
Yep.
about your health.
Yep. Yes.
Hey, you tell me you made some changes.
Yeah.
You lost a lot of weight.
Yeah. Yeah.
Yeah, congratulations. Hats off to you.
Right now, 48 pounds.
Mm-hmm.
Yeah. So I'm
Mm-hmm.
about 48 pounds right now, but I'm not where I want to be.
Mm-hmm.
I'm still, trying to get to where I want to be.
Yeah, and for your height, that was entirely too much weight.
Yes, it was.
It was entirely too much.
Telling me.
Hey, here's a fact. I said, do you go to church? And if you're in church, look around and tell me how many people you see in their late 70s, 80s, or 90s, the few that are overweight. How many do you see? Do you know anybody in their late 70s, 80s
Not
Yeah,
that.
I do.
Not that.
that
overweight.
But
are overweight?
But I
I
don't see them
don't.
overweight. No.
Why is it that we don't see people in their 70s and 80s that are overweight?
That's a great question.
Hmm.
Okay,
Let
Doc.
her- let
Tell us,
her-
Doc. Tell us, Doc. Why?
Why y'all think?
Why don't we see them that's overweight?
In their 70s and 80s, why don't we see people in their 70s? Y'all tell us in the chat. Put in the chat. Why don't you see people in their 70s and 80s that are grossly obese?
That are not, or they are?
That are
Oh, that
gross-
are. I
that
thought you
are-
said that are not.
that
Oh.
are
Oh, I can answer that. Because they didn't eat right. They didn't take care of their bodies. They didn't exercise.
but why don't we see them around?
Oh, they're dead.
Yes.
I thought you were saying something else. Oh, they're dead.
Right.
Yeah,
They're dead. They're not in the pews anymore.
yeah. And that's
They
the
name
truth.
on
They name them.
Yeah, that's the truth. I mean, you don't see a lot of people grossly obese in their late 70s and 80s because they're already dead.
Wow.
Mhm.
That's true.
Yeah.
That is true. And we wanted to get a hold of it. I actually lost 60 something pounds.
Wow.
Yeah, I lost 60 something pounds. But it's been 2 years.
Wow.
We did it slow. So when he started seeing my results is when he said, I want to get on that bandwagon. And
Yeah.
so
You guys were doing the GLP,
yes.
the injections?
Yes.
Yeah.
Yes.
And you've dropped 60 plus pounds,
Yes.
and you dropped
48.
I'm at my goal weight now.
See?
I'm done.
That's right, and looking great. Congratulations to
Thank
you.
you, Lord.
There you go. Praise the Lord for
Thank
that.
Yes.
So, that's somebody that wants to keep living.
Yes.
Absolutely.
Yeah. So you also saw that, hey, my wife dropped this week. Man, I gotta get this weight off.
6 months after I saw her, I'm like, oh. And then still rolling out the bed.
Yeah.
And then rolling, I mean, not able to get up. I had to roll out of the bed. That wasn't fun. at all.
Yeah.
You know, so,
Oh, let me tell you what Carl told me about the weight in his penis. And you can tell us if this is a fact or fiction. He said that when a man has a gut, a stomach, that the penis is smaller. Is that true?
It appears to be smaller because what happens is that there's a suprapubic fat pad that sits right here
Mhm.
where all the hair is.
Mhm.
All right. So there's a penis, then you got your genital hair.
Mm-hmm.
What covers the genital hair is covering the suprapubic fat pad.
Mm-hmm.
And then you got the gut.
Mm-hmm.
All right. So now he looks down, he's got to look over the gut,
Mm-hmm.
and his penis is kind of turtle shell back into the suprapubic fat pad.
Mm-hmm.
So he looks like he got just that much.
Mm-hmm.
I mean, now if I go take the fat and I push it back, he got that much penis.
Mm-hmm.
But all that fat is sucking it back in like a turtle shell. So he's like, man, don't gain all this weight. My man don't got small down there. Yeah, he just getting sucked in by all the weight. You know, so the thing is that, you know, that's what's happened to a lot of guys over time. You know, so to lose weight, to exercise, all that helps out with your erections. Because remember, I said 3 things: blood flow. Exercise helps your blood flow. So you gotta stay active. You gotta stay active. And I also talked about with guys that, hey, if you're not in a situation where you can have sexual intercourse on a regular basis, get your penile pump and pull blood flow into that penis. You got to keep that tissue active. I always give the same example. If I take my arm and I put it in a cast like this for 5 years and I never stretch it out, this arm is going to atrophy down. All the tissue is going to atrophy down. Now the thing is, all of a sudden I take the cast off, I want my arm to just stretch out. That's the same thing you're asking your penis to do. You put it over here, you haven't used it, now all of a sudden you want it to stretch out. No, it's not gonna happen. If you don't use it, you lose it.
Facts.
Facts. You gotta use it. So even if you're not in a stable relationship, not blessed like we are to be in marriages over 30 years, you know, grab your penile pump and stretch that thing out. You know, get some blood flow in there. So, all right, so when size anxiety becomes a real issue, people start avoiding intimacy. They have that fear of being judged, and then they got relationship insecurity. We kind of touched on that before because I said, hey, I know some guys out there ain't had sex in over 10 years, you know, because they are just avoiding intimacy. They're fearful that they're so small, you know, that they do you realize that's a mental health issue?
It really is.
Yeah, it's a mental health issue.
You said 10 years. I'm 10 days. I'm like, what's going on? You know what's happening?
Man, I can
okay?
I can tell you the thing about it is that, you know, if you start talking about stuff like the church, the church, most churches won't let us have this kind of conversation.
Wrong church.
Wrong church, because we have this conversation in our church.
I think it's important
It's
to
very
have these
important.
conversations.
Yes.
You know, I was trying to get the word out more in my church, and, you know, and I had somebody block me. Oh, we can't talk about that. You know, stuff like that. But, you know, the thing is,
Relationship. When you talk about healthy relationship, you're talking about a healthy church.
Absolutely.
yeah, exactly. So the thing about it is that, you know, it's important to, you know, be able to talk about these real life situations, even in the church.
Absolutely.
Even in the church,
Absolutely.
you got to talk about it because you got these couples out there. And you say, oh, set a great example for everybody else.
How?
How?
If they don't know.
That's right.
If they have no idea, then they're not going to be able to set that great example.
Exactly. And the thing about it is that things happen if you're blessed to be old, to get older together.
Right.
You know, things happen like breast cancer,
Mhm.
prostate cancer, different types of things that you go through, changes from hypertension, diabetes, all this other kind of stuff will affect your body and affect your erections, affect your intimacy, all this other kind of stuff. You got to be able to talk about it. And that's what we're trying to do here on this when we talk about real talk. Okay, so confidence versus physical size. Emotional connections matter, technique and communication, because you touched on this whole thing about communication. And now, because we're kind of getting closer to the end of the conversation here, why some men choose enhancement And you said because it boosts your confidence.
Yes.
And you desire to feel above average.
Yes.
Well, I told you it was already above average. Dude gonna be swinging. And it's a personal choice.
Yes, it is. It's a personal choice, and I feel better about it.
Well, he been look. What did you say? He's been above average all his life, so he didn't realize he was above average.
No.
So,
Yeah, because there's levels to this, right?
yeah.
Yeah.
Yes.
Yeah. So the thing about it is that I've had numerous guys come in like yourself who are already above average size. And I'm like, okay, because I have guys who are truly below average size. And I'm like, I totally understand why you want to have this done.
Mhm.
Then I got other guys over there, I'm like, dude, you sure?
I ain't trying to take the money. Are you sure?
I ain't trying to take money away, you know. So now, this is a chance for you guys, if y'all got any questions, to throw any questions in your chat, because we're going to be wrapping up our conversation. But I want to just thank you guys, you know, Carl and Yolanda, for coming on and being able to have this honest adult conversation where we're talking about confidence and does size really matters and how it really affects guys, because it affects us psychologically. I mean, our confidence levels can be just in the trash can because we're not confident about our size. And if you don't have a spouse that understands that, you know, a lot of times what happens, you know, even with spouses, you know, yeah, I know you was talking about you got to get ready and all this other kind of stuff. I've seen situations, and guys talk about this, is that, you know, man, I'm always waiting. Man, she keep me waiting for so long.
Ouch.
You know,
You got to learn how to approach. You do. You have to learn how to approach. And yeah, it's good when you can set the mood, you set the atmosphere, but spontaneous is great too.
yeah, some spontaneity is a
Yeah.
big thing. Yeah, sometimes you just got to be spontaneous and just
Yeah.
let it happen.
Yeah.
Right.
So
So let me ask you a question, because you're talking about the male enhancement. What about age? Young men versus older men, as far as the enhancements and how they feel. Like a young man feels like their confidence is already through the roof because they're getting it left and right. Or even if they're married, they're able to have sex and they feel like they're making the mark. But is it age? Does that make a difference? That's what I'm trying to figure out.
As far as confidence,
Yeah, and as far as your patients that are coming, you have younger people coming or older people?
I'm seeing guys between their 20s and 70s. You know,
Wow.
so guys are coming, and they're all coming for different reasons.
Hmm.
You know, some of them are coming because they truly are small. Some are coming because they've been mentally scarred.
Mhm.
You know, some are coming because they want to enhance their marriage.
Mhm.
You know, so guys all have their different reasons. But the thing is that you're grossly underestimating what's going on here if you think every guy's coming because they're small. No, not even at all. We got guys that are very, very large and they're wanting to be larger. You know, and I'm like, I was asking one guy, why did he want to be bigger? I mean, he was already Coke can.
Mhm.
And he was saying that my wife has had 4 vaginal births. And the thing is that she's got very copious hips. Basically, she was saying that she has a very copious vagina,
Mhm.
and she needed him to be larger to satisfy her.
Mhm.
So he got larger, and now he says she demands sex at this point because it's so much more enjoyable for her than it was before.
Mhm.
You know, because he changed his size.
Mhm.
You know, so the thing is that, you know, I'm this big because that's what my wife wants.
Right. Right.
You know,
Right.
but I've seen some guys over there that were single, and you know they kind of price themselves out of the market because now they can't find nobody to accommodate.
I'm
their
sure they
size.
can.
You know,
I'm
so,
sure they can.
so you know, make your choices. Make your choices. I'm here for you regardless. So the thing is that if you got any questions, so Sean, do we have any questions out there, Lisa, before we start wrapping this up?
Can a diabetic have it?
Diabetes, how diabetes affects it.
Okay, great. The question is, how does diabetes affect, or can a diabetic have this procedure? Yes, a diabetic definitely can have this procedure, but I want your diabetes to be controlled. Now you can say, well, my blood sugar was this morning. I'm not concerned about what it was this morning. I'm concerned about what's your A1C, your glycosylated hemoglobin. Normal is less than 6. All right. So the thing is that when you got all the sugar in your bloodstream, then the thing is that what happens is that you don't heal well.
Mm-hmm.
And you say, well, why is that? Why don't I heal well? Now, I've talked about this before. Simple example. I got a glass of water and I pour it through a strainer. The water just goes right through the strainer. The strainer represents the small capillaries in my body. So blood can just flow through. That's great. That's normal. That's what we need. But I take that same glass of water and I keep adding sugar to it. And I add sugar to it. And I add sugar to it. Now it's syrup. And when I try to pour the syrup through the strainer, it drips. It's not flowing anymore. Now, small capillaries are in the toes, which is the furthest thing away from the heart. And the blood flow is dripping through there because you got so much sugar in your bloodstream because you're not eating correct. Your A1C is off the chain. Next thing you know, you got an ulceration on your toe. Next thing you know, the toe turned black because it's dead. Now you got to have a toe removed, a foot removed, a leg removed, because you can't get enough blood flow down there because your blood is flowing through your body like syrup. So what you got to do is you got to get all the sugar out your life. So I want to know, what's your A1C? If you come in with an A1C above 8, I'm going to tell you we can't do your procedure because you won't heal up. You're the person that's going to have a problem healing or something like that. So we always want to know, what's your A1C? So if you want to have this procedure done, if your A1C is above 8, I'm going to say you got to wait. You got to change your diet. I need you to be below 8. In the 7s, definitely in the 6s, because now you're normal. Okay.
Next question. What's superior, length or girth?
Say again?
Which is better, length or girth?
All right. You already know. Girth is where it's at. I can tell you right now. The question is, what is better? Length versus girth. And I keep repeating this whole thing. Is that when you start talking about sex with the female, all the nerves are located in the walls of the vagina. So a guy can be 10 inches, but he's a pencil getting to the back. Another guy can just be 4 inches, but he's as big as a burrito, so he's stretching the walls. And that first 1 to 2 inches inside of the vagina is where all the nerves are located. You got to think about the clitoris sits at the top, but it also has these arms that go around the side. So it looks really, in real life, it looks like a big wishbone, all right, because the vestibules are going around here. So you're stretching all that. You like stretching the wishbone because you got so much girth versus just jiggling around like a pencil in a cup. Girth is where it's at.
If you have a vacuum erection device, how often should you use it?
I can tell you that, starting out, if you're having problems with erections, I need you to do it at least twice a day. Think about it like this, real simple about the pump. When you were much younger, like 10, 15 years old, inherently God put it in your body where you were waking up with erections. All right? You wake up in the morning, there's my friend, good morning. And you think about it, you're rubbing it down there, it feels good, whatever. But now you're older, or you got diabetes or hypertension or whatever happened. Oh boy, ain't standing up no more. That goes back to what I talked about before, is that if I got this arm over here and I never stretch it out, well, God kept the elasticity going all the time. So the wind would blow, we get erection, ready to go, because that penis tissue is very elastic, it's ready to go. Now, you're in a situation where you're not getting erections like you used to. Take that pump, stretch it out. If it has a pressure monitor on it, I want 10 millimeters of mercury for 10 minutes a day. 10 and 10. Why? Because 10 millimeters of mercury is the pressure that we need for good capillary refill. So we want to pull enough pressure in there where I get enough pressure to that penis, get it nice and firm for 10 minutes. That's all you need. You can go a little bit longer, but 10 minutes is all you need. At the minimum, do it twice a day. Now, you're getting erections on a regular basis. You've been taking the penis to the gym. Now it's ready to go. It's ready to stand up, whatever. All of a sudden, you stop going to the gym. You don't use your pump no more. Yeah, expect erections to start falling off, especially if you're not, in a sexual relationship. All right. Hope I answered the question. Yes, definitely use a pump at least twice a day starting out.
Is a penile Doppler ultrasound worth doing to assess any potential vascular issues regarding ED?
In those cases, that's a guy who's gotten on to the point where he's not responding. Now, the question was, is the penile Doppler needed to evaluate erectile dysfunction?
Is it worth it?
Is it worth it? Yes, it becomes an issue because now a doctor can see if you even got blood flow in there. Because when you start talking about erectile dysfunction, it's like swinging a pendulum across. It starts off as, I don't get erections like I used to, so I can take a pill, Viagra Cialis, all right? And then maybe I can use a pump sometime, whatever. All right, then, the pill's not working. Now I can start doing other things like bi-mix, tri-mix, quad-mix, where I'm giving myself injections. But then you reach a point where nothing works. All right, diabetes has completely destroyed my erections. I don't even know if I get any blood flow in that tissue. That's where you do the penile Doppler, and it confirms there's no blood flow coming into your tissue down there. At that point, you're at a point where we need to consider actually doing a penile prosthesis. That's an IPP, inflatable penile prosthesis, because everything else is not working. So yes, that study has its place.
What are the requirements and age for the girth procedure?
Like I said, what are the requirements of the age for this girth procedure? I'm getting guys from their 20s up until their 70s. So guys are coming in because, hey, they want to be bigger. It's up to you. There's no age requirement. I just need you to be older than 18.
Since girth is king, if I wanted girth, how does that procedure go? Is it surgical and painless?
Hey, I'm gonna let Carl answer the question.
Well, that procedure is painless for sure. It's very painless. I didn't feel a thing. I didn't know things had even started. The numbing, you might feel a little prick here or there, but after the numbing, I didn't even know the procedure had started. And they claim, because I don't know, they claim I went to sleep, and then they claim that I was singing. So I don't know. So if I was doing all of that, then the procedure was absolutely painless.
And this is a man that didn't want to get a vasectomy after our third child because he said they was going to pull and tug, and he didn't want to deal with that. So, yeah, I'm impressed.
Oh yeah, he definitely took a nap. And I'm trying to think of what it was. Street lights. He was singing, right? Street lights. You was singing a song.
Can you fix coronis naturally?
Well, the thing about it, first of all, the question is, can you fix coronis naturally? You got to understand what coronis is. Coronis is when you get an erection and you got a bend in your penis. It's because basically there's an injury to a sheath that's under the skin called the tunica albuginea. Once you get a scar in there, it won't let the penis stretch back out. So now it's pulled to the side of the scar. Now, you can do several things. You can inject directly into the scar and try to loosen it up. So they got verapamil, collagenases, all this other kind of stuff, trying to get it to let that penis stray back out. Or you can go over there and you can create a little bit of a scar on the other side and pull it back, back this way. So the thing is that I do usually a very simple procedure where I do a penile block. You're not going to feel it or anything like that. And I basically throw some stitches and just pull it back to that, and now your penis is back straight. Same day, give me about 30 minutes to an hour, I'll straighten your penis out, and you're on your way back home. It's simple as that. We can get it done. Do it all the time. Lisa, was there another question?
No.
Okay, all right. So the thing is that, when we always wrap this up, we always say horns up. You see, I see you got on our hat over there. So once again, I want to thank Carl and Yolanda for being so bold to come on our show and stuff like that, because I know you're going to run to some of your friends.
I know I am.
I said, girl, I saw you. I heard. Oh my gosh. But the thing is, it's a beautiful thing. And you guys have a beautiful marriage. I wish my wife was here because I would have made her come in on this conversation. So anyway, I just want to say to everybody, hey, come and see us and horns up. Horns up. Y'all wrapping us up. Y'all can close us out.